Hey everyone, welcome to my Ed Talk. So today I'm going to be talking to you about malignant hyperthermia. Malignant hyperthermia is a rare but fatal reaction to succinylcholine and volatile anesthetics, which are both triggering agents. And this is seen in someone who has a defective ranitidine 1 receptor. So ranitidine 1 receptors are receptors that everyone has on their sarcoplasmic reticulum. These receptors are in charge of releasing calcium from the sarcoplasmic reticulum whenever our body needs it. So they have calcium on the inside and they'll open up and they'll release calcium in order for it to get to the muscle, in order for us to get muscle contraction. However, when someone has a ranitidine 1 receptor that's defective, and this is due to a genetic mutation, and they receive either succinylcholine or volatile anesthetics during surgery, one of the triggering agents, what happens is that these ranitidine 1 receptors will actually remain open, and you're going to have this efflux of calcium, and it's going to lead to an excessive amount of calcium, which is going to lead to a sustained muscle contraction. So they're going to get this sustained muscle contraction, which is going to cause a depletion of ATP. And that's going to lead to an increase in oxygen consumption, which leads to a decrease in carbon dioxide. And like we learned in our last module, these two go hand in hand. So whenever you have a decrease of oxygen, and that leads to an increase in carbon dioxide, do you remember what that was called from the last module we learned? So that's the Haldane effect. Just a little quick review. Okay, so for malignant hyperthermia, they're going to be in a hypermetabolic state. So some early symptoms and late symptoms. So early symptoms, they're going to have trismus. So they're going to have that stiff jaw, which you're going to be unable to open, which is going to cause a decrease in oxygen and ventilation. And then you're going to have that rapid and tidal CO2, so you're going to see it climbing, and an increase in heart rate. For late signs and symptoms, they're going to have a fever, hypotension, and bradycardia. So other signs and symptoms that you might see, you're going to see them rapidly desatting. There's also going to be mixed acidosis, dysrhythmias, which VFib is the most common. And hypertension would be an early sign as well. And they're going to have generalized muscle rigidity. So the drug of choice is going to be dantrolene. And you're going to want to give 2.5 milligrams per kilogram IV every 5 minutes. The max dose is going to be 10 milligrams per kilogram. And the steps for MH. So the first thing you're going to want to do is you're going to want to discontinue the volatiles and succinylcholine as well. So you're going to call for help. You're going to tell someone to get the MH cart. You're going to ventilate the patient because remember, they're rapidly desatting and the end-tidal is also rapidly climbing. So you're going to ventilate the patient 100% of O2 at 15 liters per minute. You're going to give the dantrolene. You're also going to give sodium bicarb 1 to 2 milligrams per kilogram IV PRN. And then you're going to perform cooling measures, so ice pack or anything just to try to bring that temperature down. So diagnosis. So obviously for patients, if they're in surgery and they're getting volatile anesthetics or they receive succinylcholine and you see like all these signs and symptoms, for example, the end-tidal is climbing, or, they have the trismus, increased heart rate, or just any of these symptoms, you're going to consider that they might be having MH. But the only true diagnosis that can be confirmed after the patient is stable is that they're going to have this testing, which is called caffeine halathane contracture test. And what this is that they're pretty much going to get a muscle biopsy. And this sample of live muscle fiber is going to be exposed to halothane and caffeine, and it's going to determine the muscle response to the anesthetic. And this is the most sensitive diagnosis that they have right now for MH. All right, thank you.